what is blockchain and what's it going to be used for? Well, let's start with what it is.
Yeah, I think there's just seems to be so much mystery in what blockchain is. It's pretty simple. It's a database, right? It's a way to store data. What's even more interesting about it, I guess, maybe less interesting, is it like in earlier database for quite a while, you've been able to take a database and update it, make updates to not just inserts to tables. Blockchain isn't like that. Blockchain is basically like a ledger. It says, okay, I'm going to allow you to write an event, and I'm going to store it. And and the technology is such that it provides the ability to track among multiple nodes whether or not that data has ever changed or been modified or tampered with. That immutability is something that other databases obviously have, but when you spread that across many nodes that different organizations participate in, you have the ability now to be able to check that and audit that against many third parties. And so there's advantage of that. I think, there's also the advantage within blockchain of being able to digitally sign these events when they get written to the blockchain. And whoever that entity is who signs that, you can go back and see that entity was indeed who you thought it was. And that's very secure technology. Again, not new technology, but combined makes a big difference. There's another element, I think, of blockchain that's really important, and that's its ability to have a degree of digital sovereignty over those that participate in the process. Meaning, in many cases, you don't really store the bulk of the data on the blockchain. You store references to that data with ways to ensure that those references and that data has never changed wherever it resides. And so that creates an opportunity for whether you're a patient or an employer or a consumer to be able to say, well, I'm going to provide access to this data only when I see fit. And if I want to turn that access off to that data, I can. And so I think that's something that's really important. And I think the last one, as it relates to healthcare, is the fact that this isn't a technology that sits behind any one organization's firewall. It's distributed. And so in that respect, it sort of creates this neutrality that makes it easier for, in some cases, competing organizations, payers and providers, and where there are competing incentives to participate. So it's nothing technologically that new. In fact, it's a lot of the old stuff. It feels a little bit like Back to the Future, but how they combined it into that recipe, I think, is what makes it unique.